Welcome to Innovators, a series where we sit down with thought leaders in the healthcare technology space to discuss some of the latest trends impacting the industry today. My name is Justine Giancola with Inovalon, and joining me today is our very own Laurie Laxton, a clinical trainer here at Inovalon. Thank you so much for being here today, Laurie.
Thank you.
Before we jump in today, why don't you give us a quick summary of this year? What do you think the biggest challenge for SNFs has been post-pandemic?
Well, I think everyone will agree it's the new MDS that came out in October. It's actually been the biggest change they've had since 2010. Every year, nurses in the SNF world are used to having a little tweak to their MDS, but it was major this year. And so they not only had to learn some of the new questions, what sections were being deleted, it was quite a learning curve for them to prepare.
Yeah, absolutely. I know that this was, there were some really major changes this year. What were some of the biggest changes that we saw?
Patients who we normally have watched their activities of daily living, how their mobility and things like that, and they did away with an entire section. You might have heard them doing away with Section G, and now they have to fill out questions and additional questions in Section GG. That has been a big deal. Also, our trends towards the social determinants of health, they added a lot of new questions tied to that, and are training and teaching them how to make sure that they're asking those questions and obtaining the answers to put on those MDSs before they transmit them into the government.
Okay. So, as we head into next year, a lot of facilities are focused on the updates to quality reporting program. Any advice that you could give them to prepare?
Yes, definitely. Start now. One of the biggest changes that CMS did, which some of the nursing homes that I've worked with haven't necessarily noticed this, but within an MDS assessment, there is a subset of questions that must be answered because the answers to those questions drive patient quality measures. And so what they did is they produced a new list. So there's a whole list of additional questions that must be filled out in their entirety on at least now 90% of their transmitted assessments to the government. And it used to be a threshold of 80%. So that is a big change, and that started right away. And so that's going to affect them if they fall below that four-quarter average, lower than 90%. It's going to affect 2% of their annual payment update.
Okay, absolutely. So if people are not getting on this immediately, not only is it a bigger administrative burden, but this could be really very impactful financially as well.
Exactly.
Okay. Well, as we continue to look further ahead, new measures are going to be added to value-based purchasing in October of next year. So similar to quality reporting program updates, what do you think the number one thing that SNFs should be doing right now as they are making sure they're ready?
Well, we'll be having webinars. You'll be able to see webinars on the different value-based purchasing measures, but you can start now by going to the CMS website and looking at the proposed measures that CMS has put out there and start working QAPI initiatives around those measures now so that when this whole expansion of the value-based purchasing program goes into effect in a couple of years where it's actually going to affect your payment, your performance scores are already on the road to success. You've already put in initiatives to work on all of these areas. In the past, it's been all SNFs have had to worry about is their hospital readmissions. Well, now they've expanded it to 9 more measures eventually. And so if we start working just a little bits on each of those different measures, when it actually goes into effect, we're going to be a step ahead. And therefore, those SNFs that have been proactive will be those that receive the higher incentive dollars when the program goes into effect.
Okay, makes sense. So start early, start now, start using those resources that are available on CMS. That's great. Now, as these programs continue to evolve, quality resident care is at the heart of what SNFs do. We know this. What are some day-to-day areas of focus that you would recommend staying on top of for resident care and reporting requirements?
Risk. Absolutely 100% risk. So there's all kinds of ways that risk comes into play. Not only from looking at a patient's perspective, so you're dealing with elderly residents who have perhaps weight loss, skin issues, they're at risk for developing pressure ulcers, mobility issues, things like that. So, of course, we want to look for those areas where patients are starting to decline and act appropriately. But we also have risk that staff could be causing. So from an infection perspective, making sure that the biggest tagged F tag that they receive on survey tied to infection control has always been hand washing. Well, simple tasks like that, making sure the staff are washing their hands so that they're not promoting infection. Whilst also watching the maintenance staff, making sure the floors and all of the surfaces in a room are terminally cleaned after a patient discharges. Very important, so we're not spreading any kind of spores. And also the linens, the staff taking care of the linens. There's a whole process they need to be following to make sure they're not spreading infection in that realm. But also thinking about your staff. Staff sentiment, we talk about that a lot here at Inovalon, and making sure that your staff are well-trained so that they are comfortable coming to work, not overworked, scheduling them in a logical manner so they're not putting patients at risk because they're being overworked or they're not trained or have been given the policies and procedures that they need to follow to make their jobs easier to take better care of the patients. So I think it puts your staff at risk too, because you don't want them stressed out. We don't want to be dealing with any more turnover than we have to. And then, of course, we don't want to put those residents at risk as well.
So it really is important to consider all of these other areas when we are talking about that resident. Well, Laurie, thank you so much for joining us today. It's been great talking with you as always. Thank you to everyone who tuned in today, and be on the lookout for our next episode of the Innovator series.